Dear all SESMI members and participants, Assalamu alaikum and very warm welcome to webinar arranged by Saudi Society for Medical Education, Riyadh office. I'm Dr. Shazia Iqbal, Chairperson and Head of Continuing Professional Development Activities at Saudi Society of Medical Education. In medical education, assessment is one of the very most important and powerful component because it has steering effect on learning and curriculum itself. So being assessor, how to decide about scoring is a trick. And it is of great concern for faculty members that how to score, how to define the minimum performance required for a particular level of achievement in assessment. So as medical educators and faculty members, we have to learn how to determine the minimum pass level to separate competent students from those who do not have performed well. A large number of methods have been used in assessing scoring for written and clinical examination, and one of these methods, standard setting in assessment. And this webinar is to offer an insight into standard setting in assessment, how to identify certain points on a mark scale with particular performance standards. So I'm very much honored and delighted to present our distinguished speaker, Dr. Naveed Yusuf. Very warm welcome, Dr. Naveed Yusuf, to SESMI Riyadh office. Dr. Naveed Yusuf is Chair and Associate Professor at Department for Education Development, Faculty of Health Sciences, Aga Khan University, Karachi. Dr. Yusuf obtained his PhD in medical education, specializing in standard setting and psychometrics assessment from University of Ambrosania, Italy. He did his fellowship in medical education from University of Alliances at Chicago, specializing in psychometrics for Royal College for General Practitioners, International South Asia Board, and he's a member of International Association for Educational Assessment Recognition Committee. He has over 15 years of teaching and faculty development experience, national and international. His expertise and interests are primarily in curriculum development, large-scale assessment, and psychometrics, faculty development, educational research. So very warm welcome, Dr. Naveed, and this session will be recorded, so all participants will receive recording of this session at the end. We shall keep question and answers by end of the session. I shall be moderating this session and shall keep eyes on chat box, so you can write your questions on chat box, or at the end you can raise your hand to get involved in active discussion. So over to you, Dr. Naveed. Thank you so much for joining.
Thank you so much. Assalamu alaikum and good evening, everybody. It is a pleasure and an honor to present from the platform of Saudi Society of Medical Education. And thank you so much, Dr. Shazia, for the request and for having me in the session. The topic today is standard setting, the art and science of setting defensible and credible cutoff scores, passing scores, or minimum required scores or performance levels. We will proceed. I will try and keep this as interactive as possible. And I have another device with me with the chat box open. So feel free to respond to my questions, or if you want to make any comments, as Dr. Shazia has said, or if you have any questions, to type in the chat box. Dr. Shazia, I'm sure, will be noting all your questions. I will also try and keep an eye and see if I can respond during the presentation, and the rest we can take at the end. By the end of the session, we should be able to recognize standard setting as an important step to enhance the validity of assessment decisions, describe the commonly used standard setting methods with their strengths and limitations, and differentiate between compensatory and conjunctive standard setting. So let's look at assessment and what is the purpose of assessment. What we try and do when we do assessments, examinations, tests, and quizzes, we try and measure. We try and measure the level of achievement of our students. How much do they know? How much can they perform? How much values do they possess and demonstrate as far as the affective domain is concerned against the learning objectives or performance expectations or EPAs or the curriculum holistically. And when we measure them, we then try and differentiate students from one another based on the performance we have measured. And we try and differentiate them as to they know much better, they have scored higher, they have better grades as compared to others who have relatively scored lower or have lower grades. And when we have this differentiation, many or most of the times, we then classify these students as pass and fail, or pass, fail, and honors. And we do this using some benchmarks, using some cutoff scores, or passing requirements, minimum requirements, or minimum passing requirements, thresholds. And many of us are clinicians. We know if you want to classify any patient as anemic or normal, diabetic or normal, and so on, we need to have these cutoff scores, which are based on evidence, based on science. And likewise, in assessment and in education, we should have these cutoff scores, these requirements or thresholds based on certain rational evidence or some science. And we have to ensure that all these steps, specifically up to the last step, which is classification, is valid to make good, appropriate, valid assessment decisions. And to make sure that we make valid assessment decisions, we give valid and reliable scores and results, we do all kinds of stuff. We look at curricular outcomes, table of specifications, we make a blueprint, develop a valid exam based on the blueprint, try our best for standardization of the exams, fairness of the exams, objectivity of our marking schemes, rubrics, rating scales, ensure reliability. However, after doing all this, are our assessment decisions valid? Are we also making sure that the final step, which is the cutoff score, setting up the passing score, is valid? So let us take this first example on the top. Now you have measured your students against the learning objectives, against the domain, against the outcomes and competencies. You have got their scores and grades. They are differentiating. There are students who have performed lower. There are students who have performed higher and have scored higher. However, now if you want to classify as to who should be promoted, who should be graduated, who should be certified, who are qualified enough, competent enough to be licensed to practice, where is the cutoff? Where is the threshold? And how are you going to determine this valid cutoff is the question which we will discuss in the session today. Or if you have multiple cutoffs, for example, you not only want to differentiate your students between pass and fail, you want to also have a cutoff for honors, gold medals, scholarships, and so on. How are you going to define these thresholds or cutoffs? To ensure right till the end that we are making valid assessment decisions. So standard setting is a science. It is a scientific process which helps us to establish or identify a credible, defensible, and acceptable cutoff score, passing score, minimum performance requirement for our assessments and examinations. And how did it all started? It is a very interesting story I am very fond of narrating. So many decades ago now, it all happened in an American law university. And since the students were studying law, there were a few students who failed the exam. And out of those, a very few failed the exam by a very small margin, say, for example, by 1%. So, for example, let's assume that the passing score for that university was 60%, and those students who got 59% went to the court. And they filed a case against the university. And the case was, how can the university prove or justify that our peers or class fellows who have scored 60% on the exam will be good lawyers, safe lawyers, and we who have scored 59% on the exam, on the same exam we have been studying together, will not be good lawyers, credible lawyers, or safe lawyers. And very interestingly, the university lost the case in the court because they did not have any justification, rationale, or evidence for the pass mark. They could not prove that students scoring 60% will be good lawyers and students scoring 59% will not be good lawyers. Now think of your institutions, your programs, your degrees, your licenses you offer to your students. What evidence, what rationale do we have when we set off the cutoff score? And when we decide that these students need remediation, they need to repeat the year, study further, they are not ready to be a safe doctor, and these are the ones who will be safe, good, successful doctors. So there are various methods of standard setting, passing a credible, defensible cutoff score. The first one is the fixed standard. A fixed standard is which most of us use in our institutions. It is fixed, it is historical, it is celebrated because our ancestors used to use it. We at the Aga Khan University still, for many exams, use a fixed standard, which is 55%. Why do we use a 55% pass mark? Nobody knows. Just because our seniors and their seniors and our ancestors used it. No rationale, no scientific basis, no evidence. And then there are other methods which are known as standard setting methods. And standard setting methods are largely classified as norm-based and criterion-based methods. So if I may ask you, what do you understand by the word norm? And hence, what do you understand by norm-based? Your responses in the chat box, please. So what do you understand by the word norm or norm-based? Waiting for your responses on the chat box.
Yeah, please, participants, you can write in chat box your response.
Cohort dependent, yes. Very nice, thank you. Norm meaning the usual that is agreed upon by all faculty members. Yes, Dr. Mona, very close. According to group cohort, yes, Dr. Katan, I agree. So norm-based is depending upon the group, your population. So if your population is scoring higher, the passing score will be higher. And if your population, your cohort, your class, all the candidates taking the exam are performing lower, the pass mark automatically comes down lower. So it is entirely dependent on your group taking the exam. Percentile is totally depending upon the group that I write in my later slides, and I'll give you a few examples. Now let's come to another type of criterion-based. So what do you understand when you read the word criterion and criterion-based standard setting methods? Your responses in the chat box, please. Okay, very nice. A criterion or standard that is set to be achieved based on specific criteria. Yes, of course. A predetermined standard. Yes, Dr. Rabia, I agree. So it is based on the criterion, a predetermined criterion. And what is the gold standard for the criteria? Any thoughts? What is the basis of the criteria? Some features should be designed to make pass or fail, yes.
Previous experience, old experience, peer experience.
Previous experience, yes, I agree, Dr. Salahuddin. I completely agree. It is very important. What else? Evidence-based, yes. Item analysis, yes. But what is the central piece of entire education? It is your curriculum. It is your learning objectives. EPAs, your table of specifications. It is what you want your students to achieve. That becomes the central focus. And based on that, you determine your criteria. So it's the curriculum, it's the learning objectives. How much is the minimum you want them to achieve from all the learning objectives you have set becomes the criteria. And when you set up your criterion-based standards, there are certain which are exam-centered, or there are others which are student-centered or examinee-centered. There are other methods as well, if you can see this middle one. This is norm, criterion, compromise methods. Not very common, not very popular. However, we will talk about one of the most common examples of a compromise method as well. Let's proceed. So fixed standards, we very well know them. We love them. We use them most of the times. It is traditional. It is fixed and arbitrary pass mark. For example, we at AKU use 55%. Some stringent institutions wanting to attain high standards may use a 60% pass mark. Others use a 50%. There are certain who use 30 or 33% as well. This pass mark is arbitrary, and it falsely assumes that it determines the minimum acceptable competence because there is no rationale, no justification behind. It does not take the content of the exam or difficulty into account. Whatever you ask in your exam, whatever questions you put in, whatever OSCE stations you include in your exam, the pass mark remains the same. How difficult, how easy, the pass mark remains 50% or 55%. The pass and fail rate may vary. However, since there is no evidence, no rationale, no science, it will result, and let me be very polite, and in invalid decisions. Examples is, as we discussed, 33%, 50, 55, or 60% pass mark. Then there are norm-based methods. Norm-based are the standard setting methods, which are again historic. And using them, fixed percentage of students will pass and approximately same percentage of students will fail the exam. Again, it also falsely assumes that it determines the minimum acceptable competence. It does not. The example is given in the last row of the same column. Examples are, for example, you said that bottom 20% of my students will fail every time. Suppose this was an exceptional cohort taking the exam and all should have passed, but you will still fail the bottom 20%. Or it was a very poor performing class, poor performing cohort. At least 50% of them should not have been promoted or qualified. But since you are using a norm-based method, you will still only fail 20 and pass all in an invalid way. Or suppose you give a very easy exam based on very basic must-know content. And again, you fail only 20%. Or you give a very difficult exam and you again fail only 20 bottom percent. So it does not make sense. The other examples which are used is, for example, mean minus 1 standard deviation, which means that whatever the mean on the exam is and whatever the standard deviation is, you minus 1 standard deviation from the mean score. So suppose you give an exam, the mean score of the exam came out to be 60%. The standard deviation was 5%. You do 60 minus 5 and your pass score becomes 55%. So this is how norm-based methods work. And they dependent upon the cohort. If you see, a bottom 20% will always fail. Or those will fail who have scored 1 standard deviation below the mean score. And the mean score is dependent upon your student cohort. For a good cohort, for a good class, the mean score will be higher. For a low performing class, the mean score will be lower. It does not take into account the content or difficulty into exam. If it takes into difficulty, it takes difficulty into account inappropriately. Because for an easy exam, the mean score will be higher. For a difficult exam, the mean score will be lower, but it is not taking into account if that content, the knowledge or skills being assessed was essential, was good to know or perform, or was just trivial and nice to know or perform. The pass and fail rate remains the same, and it results in invalid decisions again. Let us now move to criterion reference, criterion-based assessment methods. This sets the minimum standard for the competence you want your students to achieve. How much knowledge, how much skills, what kind of values. So it is dependent upon what is the intended curriculum, what are the learning objectives, to perform or do. It determines the minimum competence level based on the student level content and difficulty. So this is a third-year medical student. This is how much they should be able to do to pass. Or this is a second-year postgraduate resident, and this is how much they should be able to know to graduate or to proceed further into learning. It takes content, relevance, and difficulty into account. The pass and fail rate will vary. Sometimes a few students will fail. Sometimes no one will fail. Sometimes all of them may fail if they don't know what they should need to know. However, it is expected that it will lead to valid decisions. And examples, of course, are NGOF and modeling methods. We'll talk about these methods. Now, first, let me know which of the 3 kinds of methods do you follow in your institution? In the chat box, please. Just to give me an idea, do you use fixed methods, norm-based methods, or criterion reference methods? In the chat box, please. Very interesting. Fixed methods. Okay. Some more votes for fixed methods. Yes, thank you. Wow. Criterion reference. I'm very impressed, Dr. Mona. Fixed methods. Thank you, Dr. Farzana. Criterion method. And if I may ask Dr. Mona and Dr. Farzana, which of the criterion reference methods are you using? If you can just type it in the chat box quickly. Contrast group and compromise. Thank you, Dr. Mona. Interesting. And if I may also ask, if you may give me one example. Thank you, Dr. Hana. It's a mix of both criterion and fixed. That's exactly what we do at EKU. So if I may also ask you for an example where a norm-based standard setting method is a valid method to use. So can you give me an example of an exam, of an assessment, of a test where it is good to use or most appropriate to use norm-based method? OSCE? No. Admissions test, yes, because you have fixed seats. You will only pick the top 100 or top 50. So entrance exams, admissions exams, placement exams are all norm-based. Job interviews are norm-based because you will pick the best candidate. If you have 3 vacancies, you will pick the top 3. That's it. A fixed number will always pass and others will always fail. It is norm-based. right? So admissions test is one good reason to use norm-based methods. For all others, for competency-based exams, we should use criterion reference. A good example, Dr. Iman, I agree and not too much agree for honors and scholarships. We use norm-based, but it has to be criterion-based, ideally, in an ideal world. However, yes, we at AKU used to first use fixed method. Anybody who scored 80% and above used to get honors. But now we have become slightly norm-based. If too many students get 80% and above, we don't give too many honors now. And we then shift our criteria to norm-based. So it's slightly complicated. However, very soon I will pilot if we can use criterion reference method for honors. So it's in the pipeline just as a pilot first. Let's now move on to the session. So norm-based methods. These are mean -1 standard deviation, mean -1.5 standard deviation, Winian method, and Cohen method. I will not go into the details. However, if you see, all of them have standard deviations, means and standard deviation. So if the cohort is a good performing cohort, is a high scoring cohort, the passing score will become higher automatically. And if I sit in an exam with a low performing cohort, the pass score will automatically come down and I can get an advantage. So this is a limitation of norm reference methods. Winian method takes into account standard error of measurement, which is derived from standard deviation, however, also takes into account reliability. So if your reliability is lower, it will reduce the passing score to account for the error. So it takes into account the error in your scores. Cohen method is also very interesting. The formula is very complicated. However, it is just the 60% score of your 95th percentile student. So whatever your 95th percentile student have scored, 60% of that scoring student becomes the pass score. Very interesting. Now we come to criterion reference standard setting methods. Of course, we start with NGOF, the king of methods. NGOF is one of the most commonly used, very old, highly researched and validated NGOF method, gold standard for written examinations, for one best MCQs. And then there is a Hosty method, which is a compromise method, norm, criterion, compromised method. So norm-based methods are also known as relative methods, and criterion reference methods are also known as absolute methods. And then comes another group of very commonly used popular methods, which are borderline and contrasting group method. Borderline method is the king of standard setting method for OSCEs. So for written one best multiple choice question, NGOF is the most appropriate, researched, validated, and used. For OSCEs, borderline method is the most commonly used, most researched, and validated. So these are some good evidence-based methods for written and OSCE exams, and we will talk about these two methods in detail. So what are the essential elements for standard setting? First, for most criterion reference standard setting methods, such as for NGOF or borderline standard setting methods, you need to have experts as judges. And who are experts? Who have 3 to 5 years of experience in teaching the same content to the same level of students and assessing the same content at the same level of students. So as Dr. Salahuddin said, they are based on experience. Yes, because you need experienced judges who know how much to expect from these students, what becomes the minimum performance level, what becomes the minimum criteria or passing score. For NGOF, you need 7 to 8 such experts. Then you need to do capacity development of those judges, faculty development. They should know what these methods are and what is the process to follow these methods. They should be oriented about the exam itself, the purpose of the exam. Is it a high-stake exam? Is it a promotion exam? Is it a certifying licensure exam? Is it a low-stake exam? And what is the content of the exam? What is the level of the student? And these judges are guided or facilitated by a standard setting expert who is a facilitator of the exercise, of the process. And they all should have a good common understanding of a borderline student. So a borderline student is the central theme of almost all standard setting methods. And who is a borderline student? A borderline student is the one who has exactly 50-50 probability of passing or failing the test. It is also described in the literature as a marginal student, a student who on some good days will pass and on other days may fail. So a student just on the margin, on bad days will fail, on good days will pass. You are not too sure if he's a failing student or a competent enough student. It is just on the border. And that is the kind of student who is a borderline student. So now let us very quickly look at the NGOF process. How do you set a standard for NGOF? As I said, 7 to 8 judges are required. So you take 6 or more judges with a standard setting expert. Then you discuss the purpose, the process, and qualities of a borderline student. And the judges, in a very confidential way, in a closed room, are also allowed to take names of any students to clarify and make sure that their understanding is very clear. They can name any student from the recent past, that this is the kind of student which is a real borderline student. He or she could do or knew this kind of knowledge, did not know or could not perform that kind of skills, and that becomes facilitates understanding of the performance of a borderline student. Then the assessment items are shared with the judges, the questions, the stations, and each judge will estimate the performance of a borderline student on each item. So suppose for one best multiple choice questions, for each question, each judge will ask himself or herself, what is the probability of a borderline student to perform this MCQ correctly? So for easier items or for must-know essential content items, your percentage will be higher. You expect more borderline students to answer that question correctly. For trivial questions or for nice to know or very difficult questions, you expect less percentage of your borderline students to perform that question correctly. And this is how each judge independently will respond to this question for each MCQ. And then what we do, we take an average of the percentages. Just to simplify, if there are 3 judges, one said 20, the other said 30, the third one said 25, the average becomes 25, and 25% becomes the passing score for that MCQ. If the difference among the judges is more than 20%, so one said 20%, the other said 50%, the third one said 60%, the first one probably is far away from the other 2 judges. And that needs to be rediscussed because there is some misunderstanding in the judgment. Either they have not understood the content or the expectation or the learning objective or level of the learner. How come an expert is so far away from other experts? So if difference among judges is more than 20%, it needs to be rediscussed. And then they can read. Yes. Is there a question?
No, I don't think so. There is question.
Okay,
Mistaken
right.
by
Thank you.
somebody.
Thank you. And then there are different variations in the literature. So when they rediscuss, they have the opportunity to change their judgment. Sometimes the judge who is an outlier gets to convince all other judges that I am correct, and all other judges reduces or increases their judgments. Sometimes majority of the judges are able to convince an outlier, and the outlier may increase or reduce their judgment. In other cases, the outliers may remain outliers and they may not agree with other judges, and they say, no, this is what I believe. I will not change my judgment. I will not change my person. And in the literature, there is a variation. You can decide to average out all the judgments, or you can exclude the outliers for that MCQ and then get the average. At AKU, we exclude the outliers because we know that outliers highly influences the mean score, and it is a chance that it will negatively impact the mean score, which will become the passing score. And hence we at AKU give chance, and they can make the other judges change their judgments based on evidence and rationale. They can change their own judgments, but if outliers remain outliers, their scoring, their percentage for that one item is not included. The passing score, the judgments are averaged for each question, and the average for all questions are again averaged or total to get the passing score for the exam. So this is just an example of the ANGOF. I have a question from Dr. Santosh. Can the students' prior exam performance becomes an alternate for the experience? This is a very good question, Santosh. And there's a lot of evidence and lot of literature available on this. There are a few experts and few researchers who propose to show prior students' previous cohorts data on the same exam or on the same questions to the judges so that they get to know and their expectations become realistic. And there are other experts who vouch for and who promote that we should not show prior students' data to these judges. Because what happens, they believe that it influences the judges and makes a criterion reference method a norm-based method. It pollutes with norm-based thoughts into your criterion-based exam. Because when you are looking at the data, you are now getting influenced by norm-based performances. So from a very purist point of view, if you want to keep your criterion reference method very pure, rich as criterion, you will not show them prior data. However, there are certain experts who propose and who have written widely in the literature that yes, it is beneficial to show prior performance data to the judges so that their expectations become realistic. There are challenges, Dr. Karim. I completely agree. Even for certain specialties, we don't have enough experts to follow ANGOF, and we can discuss this after the presentation. And please remind me, I will give you certain examples where we even don't have enough senior staff members to make 6 or more judges for ANGOF. I agree. Now let's very quickly discuss borderline methods. So let me go back. Sorry. ANGOF method was an examination-centered method. It is an exam-centered method because you are looking at the questions. You are looking at the exam. You are thinking of what is expected from your borderline students by looking at the exam and then deciding the passing score. That is why this is known as examination centered, and NGOF standard setting is done mostly before the exam is conducted. After you develop the exam, you do NGOF. Borderline, as I said, is an example of student-centered method. So here also, you use judges. And let me take an example of an OSCE exam, because borderline methods are the gold standard for OSCEs currently. So your OSCE examiners, your OSCE raters become the judges. So the same examiner, the same faculty member you have on the station to mark the student becomes the judge as well. So these judges again are trained. They are also oriented regarding the purpose, the skills being assessed. Now their job is to not only score the students, however, to do a global holistic rating of the student. So in addition to scoring the students, they will make their own expert holistic judgment if this student, according to them, is a failing student, is a borderline student, or is a clear student. So each examiner for each of the student on each of the stations, they watch, they observe a student performing, they score the student, and at the end, they grade the student, also grade the student as a clear fail, borderline, or clear pass. This is how this is done. And since now, this judgment, if that student is a clear failing student according to me, or is a borderline student, or is a clearly passing student, is based on students' performance. And that is why these methods are known as student-centered methods, because now you're not looking at the exam, you're looking at the student's performance and rating the students as clear fail, borderline, or clear pass. What happens next is, there are again two variations. For the borderline group method, for each station, you will only include those students who are marked as borderline. You will exclude all clear fail and all clear pass students, exclude them. Only take those students who were borderline, take their scores and get the average. That average score, the average score of all borderline group students will become your passing score. Very simple. So borderline method is a very practical, borderline group method is very practical, is very feasible, it is very easy to follow, and it is validated. However, it has its limitations. It has its limitation because you are only using data of the borderline students. On some stations, which are essential stations or which are easy stations, you may not have any borderline student, and then you get stuck. Or you have only one or two borderline students, you get stuck, because now your passing score is based on just those one or two students. It is not good data. It is not good evidence to set up a pass score. And this is the limitation of borderline group method. And that is why this method was improvised, was improved to make a borderline regression method. For a borderline regression method, you use linear regression. I will not go into the detail. You use scores of all your students now, clear fail, borderline, and clear pass. You regress your scores on the global rating. A statistician, a psychometrician can do it very easily. Any one of you who know linear regression can do this easily. And the rating score, which regresses on the borderline point of your global rating, becomes the pass score. I will not go into further details because it is very statistically dependent. However, it is a stronger method, more valid, because it takes the entire student body. data from all students into account and not only your borderline students. Yes, I completely agree, Dr. Kareem. The regression is also used for quality assurance of your exams. And I discuss this in detail when I talk of psychometrics and quality assurance of OSCEs or of other exams as well. I agree. So we have talked about that there are various methods. We have talked about that there are student-centered methods and there are exam-centered. However, how can one select a standard setting method for their own programs, courses, for their own institutions? Keep these 4 factors into account. The first one is the purpose of assessment. If it is a high-stake exam, if it is a low-stake exam, if this is a final exam. Suppose in our curriculum at Aga Khan University, students will study medicine in year 3 MBBS, and they will again study medicine in year 5. So for year 3, you know that they have more chance and more time to study further in year 5. So you will be less harsh and less stringent when you assess the standards. But when they are in year 5, you know that now you will give them license to practice, and hence you will select more stringent methods of standard setting. The type of assessment itself, if it's one best MCQs, if it's OSCEs, as we discussed, NGOF is the gold standard for written exams. Borderline methods are the gold standards for OSCEs or performance exams. What is the institutional expertise or strengths? Do you have experts who can facilitate? Have you done faculty development? Do you have enough expert judges trained? Because in order to have a valid process in place, you need to have expertise in your institutions. And what are the resources? Do your experts have time to come and do the NGOF? NGOF is very time consuming. Just think of 100 MCQ exam. For 100 MCQs, you need those 6 or 7 judges to sit together for 3 hours or 4 hours to make judgments on each of the 100 questions. Very time consuming. So do you have these experts who can give you the time? Do you have the resources? Is another important factor to think of. Now let's come to one of the very last concepts I wanted to discuss, compensatory versus conjunctive standards. So let me give you an example first, which I believe will make this easier for us to understand. We started using NGOF standard setting. And by the way, just to let you know, for OSCEs, we are using NGOF standard setting method. We don't use borderline. So when we started using NGOF standard setting method for our OSCEs in 2008, 2009, 2010, those were the years when we started. We did a study in 2011 and 12 just to see now what kind of students are passing and what kind of students are failing. So for example, on a 14-station exam, OSCE exam, where there were few history taking exams, stations, and the others were physical examination stations, what we found out, there were certain students who were failing most or all of the physical exam stations. Yet they were able to pass the OSCE exam because they were scoring very high on history taking and very high on communication skills, counseling and breaking bad news. So they were very good in speaking, but they had not practiced any examination skills or procedure skills. They were still able to pass the exam. And that was a red flag for us. So the criteria for our exams was that we used to set NGOF standards for each of the stations, and the total cutoff score for these NGOF became the passing score for the exam. And this is known as compensatory standard setting. So regardless of the kind of questions the students can perform, or regardless of the kind or type of stations the students can perform, if they can meet the minimum passing criteria overall, 50%, 54%, 66%, whatever the criteria is, they will pass the exam. And that is what we all follow, right? When we follow a fixed standard even, and if the standard is, for example, 50%, anybody who scores 50% of the MCQs correct, we make them pass. We don't look at what 50 MCQs have they failed and what 50 MCQs have they passed, right? However, the conjunctive standard looks at these skills and knowledge. So after the pilot study, what we now do is the student have to meet the overall passing score. However, the student have to also pass at least 50% of the history taking stations and 50% of the physical examination and procedure stations. So no student can fail if they have their major weakness in history taking or if they have their major weakness in physical exam. And now let us read this, and I'm sure it will be very easy. So compensatory standard is a standard set on a total test score. Any combination of performance is acceptable as long as the examinee meets the cutoff score. Conjunctive standard explicitly defines the kind of skills or the combination of skills that the examinee must pass in order to pass the exam. It does not allow a candidate to compensate for relatively poor performance in one content or skill with a high performance in other skill. So if the examinee is very good in history taking, but does not know physical exam at all, will not be able to pass using a conjunctive standard, but will be able to pass using a compensatory standard. Having said that, there is no gold standard. I know at least a few of you would be very disappointed. However, we know it's a science, it's a process to make your passing score less arbitrary and more defensible, more credible. And that is why some further thoughts. So now there are many papers coming out on standard setting, which are not only talking about the process, the implications, and other factors to take into account. Earlier, it used to say you use a gold standard and stick to it. Even if your 100% students are failing, even if your 100% of students are passing, follow the process well, train your faculty as judges, and blindly follow the standard. But now, people are learning, experts are recommending other things. They're saying you also have to look at political and social issues. If your 100% of students or 80% of your students are failing, have you set a very high standard? Were your judges expecting too much? Did they understand borderline students and borderline performance correctly? Was the teaching appropriate, or was there teaching issues and now the students are being penalized? Were the learning objectives clear? So there are many political and social issues which now the experts say should be taken into account. Another recommendation that is now coming is using at least two methods. Don't blindly follow one. Use at least two valid recommended methods. And if they are valid methods and if you have used them correctly, they should give two very similar passing scores. They will give different, not the same, but similar passing scores. And then they say a committee of experts should sit together. And that is where the role of data then comes in. Anybody who asked me, Dr. Santosh, the role of the data. So it's not the previous data now. So a committee, your assessment committee, your exam committee sit down together. They say we used NGOF. This is the passing score. We also use borderline. This is the passing score. So many students fail using NGOF. So many students fail using borderline. This was the exam. This is what we know of the students. And then the assessment committee recommends what passing score to be followed. So now standard setting, as the time is progressing, is now becoming a standard recommending process. And this is what will happen in future. For the MRCGP international exam, I am their advisor for the board. And what we use is both borderline group and borderline. For OSCEs, we use both borderline group and borderline regression. So we use borderline only, but we use both, and then we use other processes to come to a passing standard. This brings us to the end. Thank you very much. If there are any questions, any further thoughts you may want to share, you are welcome. Over to you, Dr. Shazia.
Yeah. Thank you so much, Dr. Naveed, for this wonderful presentation. It was really very informative, especially the way we got basic concept of different types of standard setting and the difference between norm and criterion-based assessment. So we are ready to take questions. Yes, Dr. Karimuddin. Yes, please, you can unmute, Dr. Karim.
Thank you very much.
Participants, you feel free to write your questions. Yes, please.
Thank you very much for this very explanatory or self-explanatory presentation. And I have one question and one comment. My question, Dr. Naveed, some people, they do believe for innovative curriculum where non-subject experts, they share in teaching, like in problem-based learning, they can't be a part of Angoff method or criterion reference method. How could we address this issue? Number second, I think.
Okay. So
yeah.
Yes.
I think the second thing now in many curriculum, I observe that people start to work in Angoff by making a factor to come to the fixed mark approved by the institute. To multiply by some factor, then they will come to the designated or designated fixed mark for the institute. Number third, my comment is regression, borderline regression line. I think the best place to use it, not only to determine pass or fail for the whole OSCE, for certain station. Nowadays, the station of professionalism, for instance, or counseling, if a student can't pass it and he wants to compensate on other station, I think this should be addressed by using this borderline regression line. Thank you very much. Hello?
Thank you. Very, very important questions. I will try. Yes. Yes. Am I audible, Dr. Uzma?
Yes.
Yes.
Yes. Thank you. I will try and switch off the video because it might interfere with my voice. So your first question, if I heard correctly, was including junior faculty in Angoff and trying to be innovative. It is always a good idea to involve them so that they become trained and oriented to the process. However, one has to be very watchful of the standards they are proposing. So if they are outliers every time, you may have to think a second time to include them as your judges. Okay. Second, they cannot become a majority. Mm-hmm. So if you're 8 judges, you can have 1 or 2 junior faculty members. And if their judgments are close to the expert ones, you're very happy. If their judgments are not, you have to be watchful. Yes. Your second point is, again, becoming innovative. If I understood your question, you said using Angoff and then making it as a fixed standard. Let me give you an example. I think we need some more research around it, but I will give you an example from my own institution. So we started using Angoff for OSCEs, which is very resource intensive. So we started from year 1 because we start using OSCEs and clinical skills right from year 1 MBBS. We then moved to year 3. We moved to year 2 and then year 3. So when we reached year 3, what we found out that the standards coming out were very similar to our fixed standard. So they were very similar to 55. Our fixed standard was 55. So the standards were coming out as 57, 54, 53, 56, 55. And that gave us confidence that our fixed standard was not bad. It was very closely valid. And that is why we decided to wait a little further, a little more for a few years, and then start standard setting for year 4 and year 5, because these are very busy clinicians. So sometimes it can give you an evidence about your fixed standard as well. So for example, for our MCQ exams, there is a concern that experts may not be able to set so many standards for so many exams because we have so many MCQ exams going out. And what I propose is, let's do a pilot and see if these standards are coming similar for similar specialties. Then you can give a gap of 2 years and do the standard setting after every 2 years. If it is coming out to be similar, because our exams are very tightly regulated, we have a very stringent blueprint criteria. We use so many difficult, all questions are tagged as easy, moderate, difficult. We will use so many difficult, so many moderate, so many easy questions. We will use so many good to know, so many must know. So the exam is very tightly calibrated, and hence it is expected that the standard will come out to be similar. So these are the reasons where this can work out. However, we will need more research on it. Your question number 3 on the linear regression and on the conjunctive, one has to be very careful that you cannot do a pass-fail on small number of questions. It will become unreliable and invalid. So we do a conjunctive when we have 6 history-taking stations, when we have 6 physical examination stations. We don't do a conjunctive standard for professionalism or for communication because we only have 2 stations on communication. We cannot pass and fail students if we have only 2 stations. It becomes unreliable. So if you are using conjunctive for each skill set, make sure you have enough stations for reliability as well, and not only for validity of the method you are following. I hope I've responded to your question.
Thank you very much. Thank you very much. Great. Thank you.
Yeah.
If we have
Thank you
time,
very
we can
much.
move on
Yes,
to
I
the
can
other
see.
questions, Dr. Shazia. Yes.
Yeah. Yes. Dr. Faisal, you can ask your question, please. I can see your hand.
There are other interesting questions as
Dr.
well,
Faisal.
which are written. Okay. Yes.
Yes, Dr. Muhammad Mansoor. Yes, Dr. Muhammad Mansoor, he is saying, thank you so much for informative presentation. What do you think that AI can have a role in that? What's with its prediction power? So what is role of AI?
Very
Artificial
interesting
intelligence.
question, Dr. Mohammed. Very interesting question. Please search for my paper. Yes. So please search for my paper, which was published on standard setting in 2014 in Teaching and Learning in Medicine journal. That paper talks about of a purely statistical method, not artificial intelligence. A purely statistical method, and it came to be very close to borderline regression method. So I'm sure artificial intelligence will be much better than statistics. So if a statistical method can give you results which were very close to borderline regression, I'm sure artificial intelligence has a role to play. Time will tell us. Yes. Next question,
Yeah.
Dr. Shazia.
Yes, Dr. Salahuddin, you can unmute, can ask your question.
Okay, thank you very much, Dr. Nadeef, for such a wonderful presentation. My question is that, as you know, that the exam preparation is a fragmented process, and particularly in the medical education, the system is such that there is a transformation of clinical skills from one level to another level. Now, how we will ensure the reliability of the standard setting when we have people from different perspectives as judges and based on the area of expertise, because this is not only the transfer of knowledge, but rather the experience which one can transfer to the other group of the students. So how we can ensure this in such area when we have judges from different perspectives, and they can be the part of this committee or this setting. Number one. Number two is that what is the actual clear-cut definition of the borderline student? I mean, as I said earlier, it is experience, but do you think that this is a good rationale for defining a borderline student? So I need your experience, and I'm sure.
Very good questions again. Thank you so much. First, judges, yes. See, it is very, very important to select appropriate judges. They may come with their different backgrounds, and that's the beauty. They may come from different contexts. However, they have to be experts. They have to be teaching the same content to the same level of students for 3 to 5 years and assessing the same content to the same level of students for 3 to 5 years. So they, irrespective of coming from different contexts or different backgrounds or having different beliefs, they will have the same or similar experience. And during standard setting, one of the quality indicators is, now you have your 8 judges for NGOF. If their judgments are close to each other for each question, it is an indicator of validity of your process, because your judges are judging the difficulty or expectation from a borderline student very close together, very similar. However, one of the red flag during a standard setting exercise is that your judges are judging far apart. One is saying 20, the other is in 40, the third one is saying 64, the fourth one is saying 93, which means there is some problem. Either you're not following the process, or they are not experts, they don't know the content, they have not understood the definition of a borderline student. There is some problem. So during standard setting, a quick quality indicator is that the judgments are similar. There may be 1 or 2 outliers for 1 or 2 questions, and you can ask them to discuss. However, I get very happy if the judgments for each question are close to each other, and is a red flag for me. If their judgments are far apart from each other, means there is something wrong. Second, definition of a borderline student. I completely agree with you. We should write a paper on this. We should write editorials on this. It is very theoretical. It is open to be contested because it says which has a probability of passing and failing. So really, we should not ask the judges who must pass, how much should they know. It is based on their prior experience. And I have done some experiments and I have not published it. As soon as you change your question to that they must know this, or the standard goes very high, it goes unrealistically high. So it needs much more research, Doctor. And I completely agree with your question. I completely agree with your concern. Wherever I do this presentation and I do this session, this question comes up, and if there are other experts, they all agree that this needs more work now.
Yeah.
Thank you.
Thank you very much, sir. Thank you.
Thank you so much. There are 2 more questions in chat box. One is by Dr. Doa. What about involving students in this process? I mean, as part of judges in committee.
As far as I have read, I think I have not come across any research on this, Dua. You should definitely do it and see what happens. This is a good research paper.
Yes, quite good topic.
Yes.
Dr. Malatish, excellent presentation. Thank you. Do we need to have minimum number of students to participate in borderline method?
If the general principle is, if you have a smaller cohort, so for example, for postgraduate residencies, you may only have 6 residents or 8 residents. You don't expect 3 of them to be borderline, right? And so it is not a good method for such small cohort. I'll give you an example of MRCGP, which is an International Royal College exam. We only have 30 candidates each day for OSCE. And we used to use borderline group. And now we are also using borderline regression for the last 5-6 years. So when we use borderline group, out of those 30, We get around 10 to 12 on an average, or 8 to 16 borderline students on each station. However, there are certain stations when you only get 2 or get none, and that becomes a problem. And that is why I recommended them to also move to borderline regression. Surprisingly, the passing score of all MRCGP OSCE exams using borderline group and borderline regression for most exams overall comes out to be very close to each other. So this is what we are going to publish very soon. The overall passing score comes out to be very close to each other, regardless of the individual station passing score. I hope I have responded to your question. Next question, if there is any, or are we done?
I think we are done. We are done with all questions, and people are saying thank you so much for this a very informative presentation and clarifications. So I think it's time to end our webinar. So I shall really grateful for your time and efforts for this wonderful session. And thanks for all participants for their active participation. And we shall share recording of this session with all participants and with you, Dr. Naveed, as well. So thank you so much, and
I really
good night.
enjoyed the questions and the engagement. Thank you very much. It was a pleasure. Good night. Bye.
Good night. Bye bye. Thank you.